Talk about what we do and don't know about Quinn Meinerz's condition on Sunday.
You know, we don't know much, Tom. We know that it was an irregular heartbeat, which is sort of an umbrella term for any kind of arrhythmia or electrical disturbance with the heart. We know that he had an elevated heart rate, so this suggests that the arrhythmia was more significant. Not just a skipped beat here or there, but actually a bunch of skipped beats in a row, or a bunch of early beats in a row. That's usually what makes you have a fast heart rate. We know that it got better, so it's paroxysmal, meaning it comes and it goes. And this we often see when we have electrical disturbances of the heart, because arrhythmias can be very transient. And unless you catch them, sometimes you don't even know necessarily what you're dealing with.
Well, hearts are your thing.
Yes.
My question was, do you feel this when this is happening? Like, he must have said, I feel my heart racing.
Yes, most people feel arrhythmias and they feel like a flip-flop in the chest. So if you think about when somebody startles you, what actually happens with your heart is you have a little skip. And then after that skip, your heart pauses for a second, resets, and the beat is a little bit more forceful. So that's one type of arrhythmia called a PVC, a premature ventricular contraction. You can also have other arrhythmias like AFib, or a cousin of that called atrial tachycardia. These ones are more substantial because AFib in specifically can increase your risk of stroke. So the prognosis, or how severe this arrhythmia is, really depends a little bit on which type of arrhythmia it was, what type of electrical problem, and that will tell us whether or not he's at risk for having it again and whether he can come back to play.
Yeah, I was going to ask you about that, but I want to mix in a little football here. Offensive linemen are generally considered to be probably the toughest group of the toughest guys who play football. And if they say, I think I broke my leg, but I can play.
Yeah.
So for this, it's probably pretty serious for him to say, hey, I need this checked out, or I don't think I can play right now. It gives you an idea that it's pretty serious. So how do you develop a long-term diagnosis off what is at this point, all we know of is a one-off?
So we'd put a monitor on him and we'd watch his heart for 2 weeks, 4 weeks, even potentially longer, to see what it's doing, what the electricity is doing. And you make a good point, which is that the type of position that he's playing, his nervous system, his stress hormones, his sympathetic nervous system is amped up. That can trigger the electricity to misbehave. So it's almost like your electricity is going on overdrive because you're so amped up during the game. Also, being an athlete can actually remodel the heart. So think about how we remodel our houses, our kitchens. If we remodel the kitchen, it looks different. We also can change the electricity. So when you're an athlete, the stresses on the heart are different, so it actually remodels, meaning it looks different. So the chamber sizes, the thickness, all different. The electricity is different. So it can trigger more easily. It can actually create a pro-arrhythmic sort of electricity that can trigger when you're having stress hormones.
The odds are this is something manageable, treatable. I mean, in most cases, that's what you find?
Yes, I have plenty of athletes with arrhythmias, you know, and arrhythmias in athletes is something we commonly sort of expect and manage. Now, if it's atrial fibrillation, he probably yet, because he's young, doesn't qualify for a blood thinner, but that's an arrhythmia that might need a blood thinner, might need procedures like ablations to try to treat. If his arrhythmia does come back, depending on what it is, he may end up needing either, you know, medication or procedures like ablations to sort of help manage it. Sometimes it can be something as simple as you're dehydrated, your electrolytes were out of whack, and it sort of sent the heart's electricity into a bit of a short circuit.
And like you mentioned, sometimes more common in athletes, but what about others? What are the risk factors quickly?
Yeah, you know, so alcohol use. So we have a holiday heart arrhythmia, which is AFib triggered by alcohol use during the holidays. It happens very common, so we call it holiday heart. Sleep apnea, which we see often here in Colorado, which is our oxygen goes down at night, can happen. And then altitude. So for us living here in Colorado, chronic sort of altitude exposure can reduce our sensitivity, especially over 8,200 feet.
If you feel that flutter, if you feel that racing, you have to report it. You have to tell your doctor, right?
Right away. So what I would do is, if you have a smartwatch like an Apple Watch, snap an EKG, because getting it in that real time really helps us to make the diagnosis, especially if it's gone later. But you should call 911 because you don't know if it's a benign kind of arrhythmia or something more significant. Because if the heart is in an electrical short circuit that it's not happy in, like ventricular tachycardia, it can cause the heart to stop.
Well, hopefully in a good way, you have a holiday heart. We appreciate you coming in, as always.
Thank you.
Dr. Paul Coley, thanks.